I'm very pleased to have as my guest tonight Dr. Chuck Johnson, Medical Director of the Yuba County Health Department, and Lee Mason, RN, Public Health Nurse, also from the Yuba County Health Department. Welcome to the Medical Explorer, and thank you for being here tonight.
Thank you for having us.
Welcome.
Thanks. Dr. Johnson, I've heard about your very interesting medical background in pediatrics, public health, and even the Peace Corps. And well, we'll let you tell us. Where did you do that, and where did you get your education and training?
Well, I got my medical training at UC Irvine, and thereafter I did a straight pediatric internship and residency. And as I was leaving residency, I had every intention of going back and becoming a pediatric neonatal cardiologist. But I signed up for the Peace Corps and went to Africa and spent 6 years there. And while in Africa, I realized that actually a lot of diseases, a lot of medicine and medical care can be and should be prevented rather than waiting and treating people when they have it. You try to prevent it before it occurs. And so I came back to the United States. I did a master's in public health at Berkeley. And then I've been a health officer up in Southern Oregon for 3 years, and just recently down in Marysville.
That's incredible. You've had a very wide background. I think Marysville is very lucky to have you here at the County Health Department. That's fantastic. There aren't too many things we can really prevent when you think about heart disease and cancer, but using some of your programs, which we saw at your department, the nutrition program, we can really help children and really prevent these things. That's fantastic.
Yeah, there are many diseases that seem to be very, very closely linked to lifestyle. Lung cancer, for example, is linked to cigarette smoking. Many of the problems of heart disease, diabetes, etc., are related to nutritional problems. And if we can get the lifestyle changes, then hopefully we can see a benefit in the decreases of the diseases.
Do you miss your pediatric neonatology and the advanced academic environment that you were involved with?
Oh, not really. I enjoy the practice that I'm in now. It's very rewarding.
It seems to me that you really do enjoy what you're doing, and I think that's very nice to see. Lee, how does a public health nurse differ in her work from a nurse that we're used to seeing in the hospital or a doctor's office, and what type of training do you need to become a public health nurse?
First of all, I think the thing that is the basic difference is that we see people before they get sick. One of the goals of the public health nurse is to go out and visit any particular patient in their home and see them as part of their family, as part of their community, and to take care of them before they become ill. As far as training goes, I originally was a 3-year RN and went back to school at Arizona State University in Tempe to get my bachelor's degree. In California, a nurse is required to have a bachelor's degree to become a public health nurse.
Do you have more responsibility as a public health nurse?
I believe you do, because you have to work independently. You don't have a doctor right there telling you what to do. You have to rely on your knowledge, on your ability to communicate with people, and to just kind of ferret out what is the patient's problem.
Well, we see that you certainly have a good ability communicating, so I certainly agree with what you're saying there. Dr. Johnson, we've learned at our little film at your department that the health department is responsible for checking restaurants to be certain they're clean and sanitary. And as a restaurant goer, I am still fascinated by this responsibility. I'd like to know really what goes on when someone checks out a restaurant. They don't just walk in and look at the menu and say it looks clean, do they?
Oh, no, no, no. They generally walk around the back of the restaurant and start checking out a lot of the things that you would more or less take for granted. For example, food that is hot, that is stored for any length of time, needs to be kept at a temperature that's high enough to prevent bacteria from growing. Food that is cold needs to be kept cold enough to prevent bacteria from growing. You want to make sure that there are sufficient dishwashing facilities, that the hoods are vented, that there are no problems with rats or insects within the restaurant. There are a whole host of things that a sanitarian will look at in a restaurant to ensure that the food you get is well prepared and that it is not going to transmit disease.
Very good. Lee, let's change a little subject. I understand that making certain that all children are properly immunized is an important role of your health department. What are the diseases that children need to be immunized against?
Well, the basic immunizations that are required for the state are DPT, which is diphtheria, pertussis, and tetanus, the polio vaccine, and then the measles, mumps, rubella. We have an immunization program at the health department where we see children every Monday from 2 to 4. We see the children on a sliding fee scale, and it is based on the family's income, so that if they are low income, they can come in for a very little amount of money.
That's very good. So this is a service that anyone can really take advantage of in our area.
That's right. Anyone, it does not have to be a low-income family. It can be any resident in Yuba County can take advantage of it, and it really does come in handy if you are low income.
Great. Dr. Johnson, recently we've heard that the Reagan administration has ordered that family planning clinics inform parents if birth control devices are given to children or young adults. Mm-hmm. It's always been my experience that confidentiality in family planning and birth control clinics has been one of their main reasons for their great success. Has this new squeal law affected operations at your health department?
No, not really. There are several misunderstandings about the squeal law. First of all, it is not a law, it is a regulation.
I see.
And as a regulation, it only affects those clinics which get Title X funding. Our family planning clinics are all state funded, so we're not affected at all by the regulations.
Well, that's fantastic to hear. I'm glad about that. How do you feel about that squeal law, Lee?
At first, I had some very real misgivings because I did not understand if I was going to have to tell families that their children were coming in for family planning. But Dr. Johnson, fortunately, is very aware of those kinds of regulations, and the communication is excellent. So we found out in a very short period of time that that was not going to be a problem.
Lee, how can people find out more details about your services at the Yuba County Health Department?
Well, we'd like them to call us if they have any questions whatsoever. We do have some information that we're very glad to send out to groups, community groups, schools, anyone who is interested. But they can call us at the health department. The number is 741-6466, and we're there from 8 to 5.
Okay. Just quickly, I was wondering, Dr. Johnson, is rabies really a serious problem?
Well, I think it's really, really over-dramatized. When you report that there is another case this year and the last case was in 1980, if you think about many other threats in our environment, actually automobile accidents, cigarette smoking, you know, flying in an airplane really seems to be more dangerous than rabies. So rabies exists, but basically it is not as big a human problem as people think it is. They tend to worry much more than is needed about the problem.
I'm glad you emphasized that. I'd like to thank you again for taking the time to show us your facilities and for being here tonight on the Medical Explorer. Thank you very much.
You're welcome.
I'd like to invite you to write to me at the Marysville Medical Clinic with your suggestions for areas and people that you'd like to see on this program. The Medical Explorer is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at 800 3rd Street, Marysville, 95901. In my next program, the Medical Explorer will meet with one of our area's leading and most popular pediatricians. We will watch, explore, and discuss the subject of asthma, and we will see a patient being treated for this breathing disease. I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.